Hello, my name is Taylor Haynes, and I will be presenting on COVID-19 in athletics. So, just a little background information. COVID-19 is a global pandemic that has obviously been a really big topic for over a year now. And at the time of my case study that I will be presenting on, research was fairly limited. But as time has gone on, there's been a little bit more information as to how COVID-19 may affect the body during and after a diagnosis. And a big issue that has been presented is the potential for cardiovascular issues after somebody has been diagnosed with COVID-19. So, in this case, it's really important because we have the athlete population, and any athlete who was diagnosed with COVID-19 that may have a cardiovascular issue after their body is already put under a lot of stress. And this is just another factor that can really affect their activity level, their participation, pretty much anything you can think of. And obviously, cardiovascular issues, that is referring to your heart, and they can be very serious. They can impact a person's life pretty severely, or even result in death, unfortunately. So, my athlete presentation today is we have a 21-year-old male football offensive linebacker who came to his medical updates with the team physician. And he mentioned that he was really sick in February, but he was never tested for COVID-19 or the antibody. And the symptoms that he described were pretty similar to those of COVID-19. Other than that, the athlete had no relevant previous medical history, no relevant family history was noted, and the athlete was in fact cleared to play by the physician. So, in those first few weeks back to conditioning, the athlete reported that his heart was racing during the last lap of practice, along with some chest pain and shortness of breath. And with this being his first time back to campus since around February, this wasn't something that was abnormal because they had a long period of time off. They weren't as active as they would be when they were in season. So these are pretty common symptoms in those first few weeks just while they adjust to the activity level. However, we had a big red flag here, which is that he continued to have his symptoms for about 2 hours after his practice had ended, which is when he had finally decided to notify the certified athletic trainer. So just a little background information here too. The CDC states that 2019-2020 coronavirus pandemic is a pandemic of coronavirus disease 2019, hence its name COVID-19, which is caused by the severe acute respiratory syndrome of coronavirus 2. So again, mentioning that this is something fairly new to us, research is limited. It was limited at the time of this case study. And there's no clear report that says that it can lead to cardiac issues, but right now research is showing that it's not uncommon. So right now I'm going to talk about how I was able to work under Dr. Nason, who is a team physician for the football team at the University of Rhode Island. And that is who all of the athletes saw for their physical updates. So these are the pre-participation physicals. And basically they're just used to determine the health of an athlete before we allow them to start participating. But with COVID-19 being the newest factor, there was a change in those pre-participation exams, which included that any athlete who was diagnosed with COVID-19 or tested positive for the antibody, they were required to receive an EKG. And if those EKGs were abnormal, then they were required to go for blood work to check their troponin levels, which if those were abnormal, then they would then be referred to a cardiologist for an echocardiogram because those are all signs of having some sort of cardiac issue. So this is our athlete update. So the athlete had texted the certified athletic trainer explaining his symptoms as he had returned to his house and was not near the athletic training room at the time. And he reported that through his friend's Apple Watch, his heart rate was at about 107, which a normal heart rate is between 60 and 100. And in this case, with a well-conditioned athlete, rather active, his resting heart rate we had marked down at around 60. So you can see that's a pretty big gap, and his heart rate was clearly increased. So, due to the fact that his symptoms had lasted 2 hours past the end of practice, the certified athletic trainer had told him to go to the student health services. So, when he called the student health services, they said that he should go to the emergency room, but the athlete did not want to go there. He wanted to see the team physician. So, he was given an appointment at about 1:45 p.m., where he received an EKG and there was an arrhythmia found. So, he was immediately transported to South County Hospital. So when the athlete arrived at South County Hospital, he was immediately given another EKG where they found that that arrhythmia was actually atrial fibrillation, which is also known as AFib. So in atrial fibrillation, according to the American Heart Association, it's when the upper chambers of the heart or the atria beats irregularly, so it quivers instead of beating effectively to move the blood into the ventricles. So in this case, his heart was beating extremely fast. So if you look here on the left side of the poster, you can see in EKG what a normal one looks like and what a person who is an AFib might have their EKG look like, and you can see those quivers in between. So this happened on September 24th of 2020, and he was listed as having a grade 4 arrhythmia, which is very severe. And at South County Hospital, the athlete was cardioverted to restore a normal heart rhythm. So basically, they shocked the heart back into a normal rhythm. So there are two kinds. There's a medication, and there's also the paddles on the chest that send an electric shock. In this case, I believe the athlete did actually receive the medication one as he was still conscious while this was all going on. So after the athlete was released from the hospital, he was removed from all activity until further imaging was done, just because we could clearly see that there was an issue going on. So on October 6th of 2020, he received an MRI and a stress test, and that MRI did show a small spot. So as you can see on the right side of this poster, that top picture is going to be an MRI of the heart, and those white spaces that you see there are actually inflammation. So when he was referred to a cardiologist after this finding, the cardiologist thought that it was myocarditis, which you can see is inflammation of the heart muscle. So the common symptoms of this, again, shortness of breath, heart rhythm abnormalities, fatigue, tightness in the chest or chest pain, maybe feeling a little dizzy or lightheaded, and in more severe cases, loss of consciousness. So in that box, we can check off a majority of those symptoms for this athlete that I encountered. So after the cardiologist had determined that he had myocarditis, he was then referred to a cardiac specialist. And that appointment was on October 21st of 2020 in Boston, Massachusetts. And after doing an echocardiogram, which is that second picture on the bottom right corner, the cardiologist determined that the spot was nothing alarming and that the athlete should be okay. So he was cleared by the specialist, the cardiologist, and the physician to begin coming back to participation in physical activity. So that's where it fell on the athletic training staff. We had to come up for an action plan for this athlete's return to play. So in this case, with the amount of time that he was out, he needed about 2 to 3 weeks of acclimation. So really getting used to that activity level. He was allowed to do 50% of the reps in any activity he was doing. And then once he reached that stage, he was allowed to go more into the practice setting, but he had to wear only the helmet for 2 days, and his work to rest ratio had to be 1 to 4. So in that case, the 1 is referring to participating in the activity, and the 4 is referring to the rest time. And he was allowed to participate in mild conditioning. And the big factor here was that at any point, if this athlete had experienced any signs of chest pain, a racing heart, high heart rate, basically all of those symptoms that he had reported before, that we had to immediately activate emergency medical services for transportation to South County Hospital again. So again, this is a very relevant topic as COVID-19 again is a huge issue right now, and we're still trying to figure out the total effects of it. And being an athletic training student, getting ready to enter that world of athletic training and potentially working with an athlete population like this, or even just any athlete population in general, it's really crucial to understand how a history of COVID-19 can really impact their health even months after a diagnosis. So the big message here is that we really want to focus on that research and also understand how to handle those situations in order to keep our athlete healthy, but also get them the care that they need in the event of an emergency situation like this. Um, Obviously, COVID-19 has been a big learning experience, and it's definitely been an interesting time to be in a clinical setting like this. But I feel that this was an experience that I will now take with me wherever I go in the future. Hopefully, more research can be done, as everything's not really set in stone. We're not sure the total effects, but we do have a vaccine now. This athlete was actually able to fully participate this season, which was moved to the spring of 2021. He participated during practices and games and actually was very successful this season and played in almost every game as a starting player. Prior to the start of the season, we did want him to wear a heart monitor, which he was able to get, but he was not required to wear those during games or full pad practices, just so that they didn't affect his performance. And there was also no alarming reason for him to have to wear one during those times. But this really came down to good communication between the staff and the athlete, just so that he felt comfortable in coming to talk to us about any issues that he may be having, so that we could get him that care that again was mentioned in the return to play plan. Of any sign of symptoms, he had to go to the hospital. I hope that this presentation was informative for you, and I wish that I could be there to present in person, but unfortunately, due to COVID-19, I will not be there. But I wanted to thank you for your time, and hopefully, you were able to learn a lot from this.